I think this session came out of the need to further define what is the role of cancer centers in Africa. In the last few years, we have seen that cancer care delivery in Africa has evolved tremendously. There are several cancer centers in many parts of many countries in Africa, and also there's another emphasis on decentralization of care, and so having regional cancer centers within a country. And then we also see the emergence of private cancer centers. And we know the importance of cancer care delivery through cancer centers in high-income countries, but this is not very well defined. And as we have seen recently from the Breast Health Initiative, recent article published showed that public cancer centers are associated with improved outcome in breast cancer. And so for this session, we will have Dr. Richard Sullivan as well as Dr. Susan Stonji as moderators, and we will start with a tour of cancer centers in sub-Saharan Africa. Are they, what sort of classification? Because there are various classifications of cancer centers. So are they units? Are they centers? Are they institutes? And what does that mean? So we will have Zambia, Ghana, and Uganda are represented in that. And then the other question that is sort of very important is, should cancer centers in sub-Saharan Africa be part of a regional or continental network? And because within countries, there are many cancer centers that are part of a network, whether it's governmental or non-governmental, but we think cancer centers in sub-Saharan Africa would benefit from, in terms of research, service delivery, creation of guidelines, monitoring of guidelines, which is known as guideline concordance. And so we are going to look into that questions. And then finally, we'll end up with a panel discussion. And this will take the thorny issues of designated cancer centers in sub-Saharan Africa, who are actually by who and for whom and what. And here we'll have our IAA representative, we'll have Professor Sullivan and Dr. Bello, who is the head of AORTIC, discussing these issues, because as I said, there is no clear-cut answer as to how, who actually do we need designated cancer centers, and who decides and how we're going by that. So I think this is going to be an exciting session, because it's a sort of a look into how this important aspect of cancer care delivery is going to evolve over the next few years, and the directions for that. And hopefully we'll also not only start the conversation, but also start sort of a research or investigation into how do we look at the role of cancer centers in the future and how we design them.